Hi there, I'm Dr. Matthew Marano. I'm an ophthalmologist celebrating 40 years as an ophthalmologist in New Jersey. I have offices in Livingston, Newark, and Denville. I have followed my father's passion as a pediatrician. He was my role model. I rounded in the hospitals with him multiple and many weekends. And then we would go to brunch. We did house calls before we went out to dinner as a family, constantly. He was the kindest, gentlest, and probably one of the smartest individuals I've ever met, who unfortunately died of ALS prematurely. My specialty is general ophthalmology. I am well known as a cataract surgery, glaucoma surgeon, as well as laser vision correction surgeon. I'll get into those subspecialties in a minute. I started, probably one of the greatest challenges I ever had was when I first started in the early 80s, I wound up in Newark in the middle of the AIDS epidemic, or at the beginning of the AIDS epidemic. We had no idea what caused AIDS or how to treat it. I took care of sometimes 40, 60 AIDS patients a week. From that time, I also learned how to do specific kinds of cataract surgery, from the old-fashioned intracapsular cataract to learning and teaching myself, as well as in teaching residents and medical students how to do phacoemulsification, which is then expanded as I became chief of ophthalmology at St. Michael's, as well as chief at St. Barnabas. I have expanded both these programs to the most high-tech capacity you have in ophthalmology. And in my offices, each office has the most competent and most innovative diagnostic equipment, as well as therapeutic modalities such as lasers for glaucoma, for diabetes. We treat macular degeneration. We have a multi-specialty family in our practice. We even have cross-linking for keratoconus. Let me deal with some of the subspecialties. As chief of ophthalmology at Barnabas, we have a laser vision correction center. We have where we treat myopia, astigmatism, hyperopia. We also have cross-linking, which is one of the few FDA-approved modalities in the state of New Jersey that is covered by insurance. Can treat keratoconus extremely well and help prevent the progression of the keratoconus from age 12 to 65. I can also put implants in individuals and do the cataract surgery that correct for astigmatism or even improve the quality of vision of individuals with keratoconus. As well as, at the same time, in many cases, I can treat individuals that have a combination of cataract and glaucoma. And there's these products called the MIGS, or microscopic glaucoma special procedures that can treat the trabecular meshwork or enhance the outflow of the eye and help lower the pressure 30 to 50% of the time in a patient at the same time as cataract surgery. If you're considering to be a patient in Marano Eye Care, no matter which office you go to, no matter which office has a doctor there, it's still my persona and the same persona of the doctors that we all tend to believe and think the same way and have the same philosophy. I expect you to feel warmly welcomed. I expect my staff to treat you with respect and educate you. And I believe that happens on a daily basis. And if you're not satisfied, or you have a problem, I have an office manager that will happily talk with you. I will reach out to you. I work in that office till 7:30 at night very often. And I am happy. And I feel it's my responsibility to make sure that you get the quality of care that you expect and deserve.